One of the services that I offer is a cupping massage. It's traditionally used by acupuncturists, and I've adapted the whole idea of cupping to the anatomy trains and how to follow the fascial patterns throughout the body. So an example of an anatomy train, one of them, is the bottoms of the feet. The fascia are connected to the calf muscles, then connected to the hamstring muscles, and then to the glutes, to the back, up over the head, and to the frontal nasal junction of the right at the nose. So that anatomy train, if it is blocked at all, is going to cause a person to be pulled back into this kind of position. And so if we release that fascia on the entire anatomy train, then it would allow that. So them to be more upright. So cupping is a process. These are silicone cups, and it's a process of suctioning the tissue up, and you can gauge light suction, deep suction, and then you can drag the cup. So when I usually start a session, I will put the cup on just lightly, and you can see that that went a little too tight. If it goes too tight, it will be painful to the client, and you don't want that. And I kind of go up and down the spine to see what area most needs some lifting of the tissues. So the tissues that are here are skin and muscle, and the blood vessels, the nerves all go through there. The spine itself especially has a lot of tissue that gets compressed. So typical massage is pressing the tissues deeper, whereas the cupping is lifting so that you have better lymphatic flow, better blood flow. So once I have those cups on, oftentimes I'll put one right over the kidney. So here's the base of the rib cage. We'll put one on each kidney, a little bit lower, and let those sit and lift that tissue up. So then I'll start with a different cup. So you see there's different sizes. One set is 4 different cups. This is my favorite set that I use, which is the soft silicone. And you can just drag the cup along the tissue and lifting that. And when you find a spot like right there, it doesn't quite want to move. So you can grab, that's a good stuck one here, so I'm going to go to this one. You can just grab another cup. So this is a parked cup. If we leave it too long, it will leave a hickey-like kind of motion or mark, and it is looks just like a hickey, just like that. So what I try to do is erase it, basically, and I'm pulling, that's toxicity coming up out of the tissue, and you just drag it along there, and it usually will put it to the other interstitial fluids, and it will erase the mark. And you can grab one. Some people don't like the marks, and I'm very cautious about leaving marks on them. There we go. And so that's pulling up that tissue really nice, but it really likes it on the spine.